Surgery in the early 18th century was rudimentary and often performed by barber surgeons rather than trained physicians. Procedures were limited to amputations, tooth extractions, and the removal of superficial tumors. Surgery was extremely painful and risky due to the lack of anesthesia and a poor understanding of infection and aseptic techniques. Known as the father of scientific surgery, John Hunter emphasized the importance of observation and experimentation in surgical practice. His extensive research and writings on surgical techniques and anatomy significantly advanced the field. In the mid-19th century, the introduction of anesthesia revolutionized surgery. In 1846, American dentist William Morton successfully used ether as an anesthetic during a public demonstration, allowing surgeons to perform more complex and lengthy operations without causing pain to patients. Shortly after, James Simpson in Scotland introduced chloroform as another effective anesthetic. These developments greatly expanded the possibilities of surgical intervention and improved patient experiences. The work of Joseph Lister in the late 19th century transformed surgical practice by introducing antiseptic techniques. Influenced by Louis Pasteur's germ theory, Lister used carbolic acid, phenol, to sterilize surgical instruments and clean wounds. Lister's methods dramatically reduced post-operative infections and mortality rates, establishing the importance of maintaining sterile conditions in the operating room. The 19th century saw the emergence of surgical specialization and the establishment of formal training programs for surgeons. This professionalization led to significant advancements in specific fields such as orthopedic, abdominal, and neurological surgery. Notable advances included improved techniques for amputations and the development of more functional prosthetic limbs. Surgeons like Lawson Tate advanced techniques for abdominal surgery, including successful operations for conditions like ovarian cysts and ectopic pregnancies. The development of neurosurgical techniques, including trephination drilling into the skull, to treat head injuries and brain diseases. Hospitals in the early 18th century were primarily charitable institutions providing basic care for the poor, elderly, and infirm. They were often run by religious organizations and staffed by volunteers or minimally trained attendants. Medical care in these early hospitals was rudimentary, with limited surgical interventions and a focus on palliative care rather than curative treatment. The 19th century saw a significant transformation in hospitals driven by urbanization, industrialization, and advancements in medical knowledge. Hospitals expanded and became more professionalized, with trained medical staff and improved facilities. Key developments included the establishment of teaching hospitals, such as London's St. Bartholomew's and Guy's Hospital, where medical students received hands-on training and education. The rise of public health hospitals, funded by municipal governments, offering more comprehensive medical care to the general population. The emergence of specialized hospitals, focusing on specific diseases or patient groups, such as maternity hospitals, children's hospitals, and psychiatric institutions. Florence Nightingale's work during the Crimean War and her subsequent efforts in hospital reform had a profound impact on hospital design and management. She emphasized the importance of sanitation, ventilation, and the layout of hospital wards to prevent infections and improve patient care. Nightingale's principles influenced the design of hospitals worldwide, leading to more efficient and hygienic healthcare environments. The introduction of advanced medical equipment, operating theaters, and laboratories within hospitals. This modernization allowed for more accurate diagnoses, complex surgical procedures, and the development of new treatments. The 18th and 19th centuries were periods of significant advancement in surgery and the development of hospitals. The introduction of anesthesia and antiseptic techniques revolutionized surgical practice, making complex procedures safer and more effective. Simultaneously, hospitals evolved from charitable institutions to professional medical centers, offering specialized care and training for healthcare professionals. These developments laid the foundation for the sophisticated surgical techniques and hospital care we benefit from today.